What if I told you that one of the most talked about circulation enzymes in the supplement world actually comes from earthworms? And in some hospitals, it's even been studied alongside standard treatment for stroke. Yeah, I know, that sounds wild. But that enzyme has a name you've probably seen on supplement labels: lumbrokinase. In this video, you're going to get a clear tour of what lumbrokinase really is, how it works in your body, who might want to ask their doctor about it, and who absolutely should not experiment with it on their own. Quick reminder: never start, stop, or mix supplements like lumbrokinase with other meds without talking to a qualified clinician who knows your history. So, what exactly is lumbrokinase in normal people language? Picture your blood clotting system like a construction site. One crew builds structures, and another crew comes in later to carefully take things down when they're no longer needed. The building crew makes clots to stop bleeding if you get injured. The cleanup crew comes in later and breaks those clots down so your blood doesn't stay too thick or sticky. Lumbrokinase is part of that cleanup idea. It's not a human enzyme. It's a group of enzymes originally isolated from earthworms that can help break down fibrin, which is the protein mesh that holds a clot together. You can think of fibrin like the rebar in concrete. Lumbrokinase is like a tool that helps snip that rebar into smaller pieces.
Researchers have seen two main ways lumbrokinase seems to work. First, it can directly break down fibrin, kind of like scissors cutting that mesh. Second, it appears to boost parts of your own clot-dissolving system, for example by increasing the activity of plasminogen, which your body turns into plasmin, the main clot-cleaning enzyme in your blood. Some studies also suggest it nudges tissue plasminogen activator, or TPA, which is one of your natural clot-busting signals. Now, does your body naturally make lumbrokinase? No. Your liver and blood vessel lining make your own enzymes for breaking down clots, but lumbrokinase itself is from earthworms, not humans. What your body does make is a whole fibrinolytic system, which is just a fancy way of saying fibrin-dissolving system. Things like regular movement, good sleep, not smoking, managing blood sugar, and keeping inflammation down all help your own enzymes do their job well. So if you don't make lumbrokinase, are there food sources? Here's the simple truth. There are no normal food sources of lumbrokinase. It's not like vitamin C where you can eat an orange and get a dose. You'd basically have to eat earthworms in a way that preserved the enzyme, which is not part of any mainstream diet and not something I'm suggesting you do. So when you hear about lumbrokinase, people are almost always talking about it as a supplement, not a food nutrient. That means the first practical application for you is actually not a capsule, it's your lifestyle. If you're hoping to support healthy circulation and balanced clotting, things like walking 30 minutes most days, staying hydrated, eating more omega-3 rich foods like fatty fish, flax or chia seeds, and cutting back on smoking and ultra-processed foods are your true foundation. These steps improve the environment that your own clot-cleaning system works in.
Only after that foundation is in place does lumbrokinase even belong in the conversation, and even then, only with professional guidance. Let's talk about the supplement side, because that's what you'll see on store shelves and online. Most lumbrokinase supplements are in capsules that are either enteric-coated or delayed release. That means the coating is designed to protect the enzymes from being destroyed by stomach acid and to release them further down in your digestive tract. You'll see two types of numbers on the label. One is the weight, usually in milligrams. Common products offer somewhere around 30 to 75 milligrams of lumbrokinase per capsule, and some brands have capsules around 75 to 150 milligrams, with suggestions like 1 to 2 capsules per day, sometimes more, depending on the brand. The other is activity, measured in fibrinolytic units, or IU, which is basically how strong the enzyme is at breaking down fibrin. In many ways, that activity number matters more than the milligrams because different preparations can be more or less concentrated. Some companies adjust the milligrams, but keep the activity the same, so you get the same strength in a smaller amount of powder.
Most manufacturers suggest taking lumbrokinase away from meals, often at least 1 hour before or 2 hours after eating. The idea is that if you take it right with a large, high-protein meal, the enzyme will spend its time chewing on food proteins instead of making it into your bloodstream. Some sources mention that food proteins can compete and reduce what gets absorbed. Is there a best dose? There is no universally agreed-on dose for healthy people, and there is no official guideline saying everyone should take it. In research and clinical practice, you see a wide range. Some protocols use relatively low maintenance doses, roughly 20 to 60 milligrams per day, while certain supervised settings go higher, closer to 60 to 120 milligrams per day, usually split into 2 or 3 doses and always under medical supervision. For you, what matters is this. Follow your clinician's instructions and the specific product label they've reviewed with you. Do not copy someone else's dose from the internet. What helps absorption? Using a product that is enteric-coated or delayed release, taking it consistently at about the same times each day, and separating it from big, protein-heavy meals may help more of the enzyme survive digestion. What can work against it? Large meals at the same time, poor gut health, certain antacids changing stomach pH, or taking it only once in a while when you remember. Now, the big question, who might even consider this and who is it definitely not for? First, there is no such thing as lumbrokinase deficiency. Your body doesn't require it the way it needs iron or B12. What people are really talking about is situations where there is a lot of fibrin or a tendency to form clots, and the idea is to support the body's natural clot-clearing system.
Common reasons people get curious about lumbrokinase include a history of circulation problems, like past clots or stroke, thick blood on lab tests, certain heart and vessel issues, or long periods of immobility. But here's the catch. Those are serious medical conditions. They are exactly the situations where self-treating with a clot-active enzyme could go very wrong very fast if you don't have a professional carefully watching labs, medications, and your symptoms. A more useful way for you to think about it is this simple self-check. Have you ever had a blood clot, stroke, heart attack, or a procedure like a stent, bypass, or valve replacement? Are you taking any blood thinners or antiplatelet drugs like warfarin, apixaban, rivaroxaban, dabigatran, heparin, aspirin, or clopidogrel? Have you ever been told you have a bleeding disorder, very low platelets, or liver disease? If you answered yes to any of those, you are not a candidate to experiment with lumbrokinase on your own. You are exactly the person who must have a cardiologist, neurologist, or hematologist involved if lumbrokinase is even on the table. If you answered no, the next step is still not start the supplement. The next step is understanding your baseline. Labs your doctor might discuss with you include fibrinogen levels, D-dimer, basic clotting times like PT/INR and APTT, platelet count, and sometimes more advanced clotting or inflammation markers, depending on your health situation. These tests don't measure lumbrokinase itself, but they tell your team how your clotting system is behaving.
Let me give you a few personas so you can hear how the advice changes. First, the budget-conscious eater. Money is tight, you're juggling bills, and maybe your diet is heavy on cheap carbs and packaged foods because that's what's realistic. Lumbrokinase supplements can easily run the equivalent of $40 to $70 a month or more, depending on the brand and dose. If that's you, your best return on investment is not this enzyme. Your main wins are going to be walking more, not smoking, choosing more beans, lentils, tinned fish, frozen vegetables, and drinking water instead of sugary drinks. If a doctor specifically recommends lumbrokinase for you, great, you can talk about whether it's worth the cost, but I would not put this at the top of your list. Second, the vegan or vegetarian viewer. Lumbrokinase comes from earthworms. That means it's not vegan and not really vegetarian either. If you're plant-based for ethical reasons, this may be a deal breaker. In that case, talk to your clinician about other ways to support healthy fibrin balance, such as lifestyle, managing inflammation, and possibly other enzymes from plant or fermented sources, if appropriate for you. But again, still not something to self-prescribe.
Third, someone living with a cardiovascular or clotting condition who is already on blood thinners. Maybe you had a clot in the leg or lungs, or a stroke, and now you're on warfarin or one of the newer drugs. You read about lumbrokinase online, and it sounds more natural than your prescription. Please hear me on this. You do not swap a prescribed anticoagulant for a supplement on your own. Combining lumbrokinase with these meds can increase bleeding risk, and stopping your drug without a plan can increase clot risk.
So what does the research actually say? And how strong is it? We're beyond the test tube stage, but we're not at the standard worldwide guideline treatment stage. A lot of the better research so far comes from Asia, especially China. There are clinical trials and meta-analyses in conditions like acute ischemic stroke and peripheral artery disease. In some of these, lumbrokinase was added on top of standard care and followed for weeks to a year, sometimes in a few dozen people, sometimes a few hundred. Some studies suggest improvements in measures of blood flow, functional recovery, or reduced recurrence, but they often have limitations, like being done in one country, having modest sample sizes, and using specific preparations that might not match what's in your bottle at home. In healthy volunteers, earthworm-derived enzyme complexes have been shown to increase TPA activity and overall fibrinolytic activity without obvious short-term side effects, which supports the idea that these enzymes really do activate the fibrin cleanup system. On the other hand, experts point out that we still don't fully understand the detailed mechanisms in humans, the long-term safety of using lumbrokinase for years, the best dose, or which specific patient groups truly benefit and which might be harmed. There is also limited high-quality data on how it interacts with many common drugs. So I'd describe the evidence as promising but early to moderate, strong enough that researchers and some clinicians are very interested and are testing it in real people, but not strong enough to say everyone with circulation issues should be on this, and definitely not strong enough to treat it as a simple wellness supplement for the general population.
Now, let's look at safety, because anything that affects your clotting deserves serious respect. The most important risk is increased bleeding. When you use something that helps break down fibrin and may mildly affect platelet behavior, the theoretical risk is easier bruising, nosebleeds, bleeding gums, heavier periods, or longer bleeding from cuts. In higher-risk situations, especially if combined with anticoagulant drugs, antiplatelet meds, or other blood-thinning supplements like high-dose fish oil, the risk of more serious bleeding goes up. Less serious side effects can include digestive upset like nausea, bloating or loose stools, headache, fatigue, or mild dizziness. Some people may have allergic-type reactions to the protein, like rash, itching, or swelling. Most supplement labels warn against using lumbrokinase if you have an active bleeding condition, a known bleeding disorder, very low platelets, or if you're about to have surgery. They also urge medical supervision if you're taking any anticoagulant medication and list pregnancy as a time for caution or avoidance, mainly because we just don't have enough safety data in pregnant or breastfeeding people. Red flags that should make you stop the supplement and get urgent medical care include black, tarry stools, red or coffee ground vomit, coughing or spitting up blood, sudden severe headache, sudden weakness or numbness, or any heavy bleeding that doesn't stop.
Let's do a quick myth-busting lightning round. Myth 1. It's natural, so it's automatically safe. Reality. Lumbrokinase acts on your clotting system. That is not a casual place to tinker. Natural does not mean harmless. Myth 2. If I take lumbrokinase, I can stop my blood thinner. Reality, that is a dangerous idea. Prescription blood thinners and lumbrokinase are not interchangeable, and switching without a plan can lead to clots or bleeding. Myth 3. Everyone over 40 should take lumbrokinase for circulation. Reality, there is zero evidence that all middle-aged or older adults need this enzyme. For most people, movement, nutrition, sleep, and managing blood pressure, cholesterol, and blood sugar will do far more for long-term circulation than a pill.
Let's wrap this up. Lumbrokinase is a group of earthworm-derived enzymes that help break down fibrin and may boost your body's own clot-clearing system. It's not something your body makes, and it's not something you get from normal foods. It's a specialized supplement that seems to influence blood flow and clot dynamics, with early research especially in stroke and peripheral artery disease. At the same time, we still have big questions about long-term safety, ideal dosing, and how it interacts with common medications. For most people, the smartest move is to focus first on the basics: moving your body, not smoking, eating more whole foods and healthy fats, sleeping better, and staying on top of your medical conditions. Lumbrokinase, if it's used at all, should be a carefully chosen tool supervised by a clinician who can track your labs and your medications. One simple action you can take today is this: grab a piece of paper and write down every medication and supplement you're taking that has anything to do with circulation, heart, or clots on the label. If lumbrokinase is on that list or you're thinking about adding it, bring that list to your doctor or pharmacist and ask, is lumbrokinase safe and appropriate for me given everything else I'm taking? Have you ever been offered lumbrokinase or seen it on a supplement label and wondered if it was worth it? Drop your experience or questions in the comments. Let us know what supplement you would like to learn about it next.